Ladies and gentlemen, unemployment is on rise among health professionals in a way that we never considered before. We used to think that when you study sciences, especially medical related, health related, you are safe. But as you already know, jobs are not there for anyone, even for doctors, for nurses and midwives, for pharmacists, for laboratory, for anyone. There is too much unemployment. And let me give you this. You see, every year, our institutions, training institutions, release thousands. For example, for nurses, between 8,000 to 10,000 nurses and midwives are introduced into market every year. Now, look at Mulago Nursing School produced 600 nurses, graduates in just 1 year last year. Now, look at this and multiply it by the hundreds of nursing training institutions that we have right now, which are between 150 to 200 or even more than that. When you multiply by that, we have thousands of nurses and midwives graduating every year. But now go to our health professionals, medical doctors, pharmacists, laboratory. We have thousands joining the market. In general, look at a university like Makerere University. It produces 12,000 graduates every year. Yes, for the past 10 years, Makerere University releases 13,000, 12,000, 15,000, 11,000 into the market, average at about 12,000 graduates every year into the market of job. But where are the jobs? There are no jobs, guys. You already know that. In fact, when you look at the government advertisements, you find they are wanting 4 enrolled nurses, they are looking for 2 midwives, they want 3 laboratory technicians. In fact, they want 1 health educator. It's even funny. Some of these even are internal because we have so many nurses and midwives who have been at work for years, but they have never been promoted. Some of them have studied masters, PhDs, bachelors, but they are still doing the work of enrolled nurse, assistant nursing officer. You know these things. There are no jobs. That is the reality of things. Sadly, or unfortunate parties, for most nurses and midwives or healthcare professionals, they were never exposed to what is called innovative entrepreneurship. They never looked at life, looked at their studies as a way to start their own businesses. Yes, we have entrepreneurship as one of the modules during our training, but this comes as just a knowledge-based, module. We cram the work, we answer questions during exams, and we pass. But really, no one ever told us that we can practically actually employ that and innovate businesses that are own. We employ ourselves and even employ our colleagues. So, ladies and gentlemen, based on our experience in nursing, in public health, and then in innovative entrepreneurship, we designed a special guide to help nurses, midwives,